Dear friends, welcome to a new episode of the show. I'm your host, Reda, and this is the Psyche and Human Body podcast. Let me thank you so much for tuning in for a new episode of the show. And now I will be introducing our guest for the episode. Today's guest is Dr. Simone. Dr. Simone is a pediatric orthopedic surgeon. Today, she will be discussing several topics, out of which how does building trust and listening to the patients and their parents is crucial in providing effective healthcare. In addition, she will be talking about how important is the lifestyle in playing a role in the child's development and how can it impact their overall health. Dr. Simone is a very knowledgeable and experienced doctor. I hope you enjoy today's episode and learn something out of it. Maybe you can benefit a friend, a family, or you yourself, you can benefit something out of it. Thank you so much, and I'll see you in the future. You're ready. All right. Dr. Simone, welcome, and thank you so much for accepting the invite.
My pleasure.
I very do much appreciate your time, and I feel very grateful for your presence here today with us.
Thank you.
Doctor, just as a starter, please let us know who is Dr. Simone and why do you do what you do?
Well, this is a quite philosophical question for me because I'm trying to detach myself from the histories that we tell about us, isn't it? So I think it's very convenient to make up our minds of what we are based on our compilations of histories and things that we sometimes like to remember.
Mm-hmm.
And sometimes we like to hide or leave aside and just make a nice picture of what we want to be.
Yes.
Based in our history and things that we remember. So I like to be an empty canvas every day when I wake up, like ready for a new day and grateful for what I have already.
Mm-hmm.
And willing to interact and have good experiences. So I'm not a doctor that goes to the work to save anyone.
Mm-hmm.
I think what we do is interact with people and try to help with the knowledge that we have.
Mm-hmm.
But if you are not deep enough in your interactions, you are not able to sell what you have to sell. And for me, I'm a pediatric orthopedic surgeon. So people come to me to not resolve their problems, but a more deep thing that is resolving the problems of their child.
Yes.
And we have usually two scenarios. We have the very worried parents that have a healthy child,
Mm-hmm.
or we have a blasé parents
Mm-hmm.
with a unhealthy child that needs to be put into the situation of knowing better what is happening and how to promote a better interference in what we can help to improve the outcomes of that child. So in those two scenarios, if we are not prepared to really interact and put yourself empty in front of them, and first of all listen, and then say what you have to say, they will go to see the fifth doctor. They are there. Usually here in the UAE, it's very easy to find the second, the third, the fourth opinion. And usually, unless I'm completely crazy in my day, that this also happens, that I cannot set up the space to be present, then the consultation might not go as well as I want. And this kills me in the end of the day, you know. I'm usually remember not the consultations that went well, the interactions that you just sat and you cross your leg and you talk to the parents. But you remember the consultations that, you know, the mother had that look to you that, you know, that was not convincing.
Yeah.
And this is horrible. It's horrible.
Doctor, it's like you mentioned something now, like on a human level, that I want to actually ask you about. Like, what makes a good consultation a good one? For example, how can we prevent the parents from going to the other doctor? I mean, what is it about a good consultation that makes it convincing?
You know, it starts with listening. Whatever you have to say can be brilliant, but if the mother didn't feel that you listen to them, they will not trust you, because they will say, well, but she doesn't know my child. I know my child.
Yes.
And this is a very powerful argument that they have. And the second thing that I like to do is to show to them what is my rationale. So why I think this is normal. Because this is within the range of what is normal for us. Kids are not all the same, and they have range of normal patterns that we accept. So when you listen and you show why you think that, it's, I think, 75% of what you have to do.
Make a good consultation, basically. I see. So a pediatric orthopedic surgeon, basically in a nutshell, what do you do?
Yeah, so we see the whole range of spectrum, from the running and jumping child to the child that have neuromuscular problems, that has the function impaired. So from this, we deal with, for example, teenagers that don't move much, teenage girls that is not used to have sports activities in their
Daily
lifestyle.
Yes.
So part of what I do for those more normal range of the spectrum is to preach what I think it's a good lifestyle and empower the kids. So when I have a consultation with 10 or 11 or 14-year-old, I usually turn to them to empower them, to give some quick knowledge and things that they can remember that can impact their life. So, for example, my coach in the gym, he's not my 101 coach, but he oversees me. And he has a nice thing that he says to me, champ, every day is an upper day, because I'm not tend to do some upper extremities.
Yes.
And this, I think, it makes my choice very easy, because whatever I put my foot in the gym, this is upper day.
Upper day. Like an automatic by default for you.
So what I do with my teenagers is more or less the same. I just say, sit up straight, don't matter what. Even if you are in the dark room alone, sit up straight. If you're feeling bad, or if you're feeling good, or if you're feeling sick. Or if nobody's listening, or if nobody cares, please sit up straight. So for those kids, I have to preach some of what I believe. And I'm very truth to my consultation. And I think teenagers are very good at spotting if you are empty or not. They are very, very good. And sometimes the mother kind of say things or point things, and they just roll their eyes and they just pass to you the message, oh, this is not really the reality of what I live with. So don't pretend to sell things that you really not prepared to back up, because the kids are very sharp. They really notice.
Why do you think they have this intuitive sense? Because it's very true, actually. Like kids and young people have this tendency to differentiate between, for example, someone who's saying the truth or not, more than elder people, in a sense.
I think they are more spontaneous to convey that. Sometimes we refrain ourselves to say. So I think our power of knowing, it's also strong, but the kids, they have nothing to lose. They just say, and they are very good to say in front of you that the mother is lying, for example.
Yeah.
So I think this is what differentiates us to the kids, and they don't have the constraint of this self-image that the masks that we
That
have
they want to convey a certain picture for the outworld.
They don't have a mask to put on. They just
be.
They don't.
They just be. Which is very beautiful, actually. Because I think this is why they have the most fun in the world. Like when we are kids, that's when we used to have the most fun. And as we grow old, we have this tendency of pleasing, or we have this tendency of putting masks, as you mentioned, Doctor. Now, you also told me about how the lifestyle affects, let's say, the structure of the child as they grow. In what sense? Like, how does our lifestyle affect how we grow?
I think we are a product of our lifestyle, isn't it? People say, "Oh, you are what you eat," but I think we are how we move, what we think, how we preserve our energy, and how we recharge our batteries, isn't it? So we are a direct product of how we live our life. Our lifestyle is 100% what we are.
Wonderful. Now, in your line of work, so you get, I think, people from both spectrums, a spectrum where, let's say, the problems arise genetically or via birth, maybe, and problems that arise via lifestyle. So can we please, let's say, put both in perspectives? Like what problems arise, for example, genetically, like as people grow normally, like since childbirth, to other problems that can arise via time, and how can we solve them? What's your approach to solving both?
Yeah, so we have two main buckets. One is the congenital diseases, and another one is developmental diseases, and a third one might be trauma for the pediatric orthopedic surgeon. So the congenital diseases, we strive to do early diagnosis to inform the parents. In this type of situation, information is power. So more they know, more they are able to deal with problems and are more prepared in terms of personal life to deal with what is the consequences of those problems. And also when we do an early diagnosis, for example, a neuromuscular disease. So a neuromuscular disease can be a product of a genetic defect, but can be an insult on the prenatal, perinatal, or postnatal life. So if you have a child that shows early signs of impairment of the motor function, because we need to know that the brain has two big real states. One is the movement. The brain is wired to move. So, for example, neurodegenerative diseases shows primarily in the movement. For example, how in Japan, that they have a very elderly population, how they really spot people that is more prone to have dementia, is that they lose the patterns of gait. So they have more difficulties with balance, going up and down stairs, the velocity of the gait changes, the pace of the gait change. And this is a direct reflex of how the brain is wired to move. So a child that is just born, and you notice that the spontaneous movement is impaired. So we have a normal fluency of movement, strength, and ability to deal with the gravity as a baby. And more the pattern of movement is rich, more we know that the brain is working well. So we have a tool that is general movement assessment, for example, that can have a very, very accurate prediction of what is the brain that is developing well or not. So you just see the child moving by 2 or 3 months of age, and you know if the brain is connecting well with the with the muscle skeletal system to make a good movement. So this is part of what we do. So whatever baby comes to us to check the hips or check the foot, I take my time. I'm not certified to do this, but we have the whole team. So when I look at the baby, I usually undress the baby myself. And I'm looking at the baby, how the baby moves. If the baby needs to have, for example, 3 of the limbs down to the table to lift one arm, this is sign that this baby is not as strong as we wanted the baby to be. Or if the pattern of movement is less rich or less, if they have less fluency, we also know that this baby. So one part of what we do is to have a checklist of everything that we can assess in this baby to rule out big things. So whatever the baby is coming to you to see. Sometimes the baby has an extra toe or extra finger, but you looking at the baby, you need to have the time to undress the baby and just allow the baby to stay there in a calm and nice environment too. And this with train you can do in a few minutes only. So this is part of the assessment of a small child. So whatever the child is coming to be checked for, you assess the neuromuscular system. That is a big real estate of
the assessment
brain.
process.
Another big thing is the vision that the brain do. So the vision, the movement, all show that this brain is working well. Then we have kids that will have developmental problems. So a child that is walking well and at one point start to limp. So then we need to check the hips. We have, for example, a condition that is called leg cover pertis. And pertis is a problem of the vascularity to the hip joint that makes this joint
lubricated or
even the shape of the joint changes.
Really?
And then we need to have few clues of the age of what is going on. It can be, for example, a limping child has a whole list of things that you need to rule out: infectious disease, malignancy, those developmental problems. You check the spine, you check the limbs, you check the rotational profile, you check the angular alignment of the limbs. And most of what, the myth of growing child is the feet, flat foot, what is the parents are most concerned about is a very, very benign problem.
Yeah.
And it's not really a problem, it's a range of the normal spectrum, like the color of your skin. So we have feet that has more high arch and feet that has low arch, and both can function well. And what we check on those feet concern is how the structure of the foot is working. If this is a flexible foot, if this is a painful foot. And most of the kids have a normal range of the foot shape that what might be impacting, even if they have pain, is the lifestyle. So a healthy, strong, active boy has much less tendency to have foot pain than a child that is on the couch eating whatever they are eating and watching TV or playing video game, because the foot is not prepared. And the kids are, they usually do nothing or 100%. So, the poor body needs to cope with a child that is, for example, with not beneficial body composition, or obese child, for example, that spend 90% of the time doing zero movement, and they want to run and jump and play football. So it will not do. The body is an amazing machine. And part of what I was drawn to be a doctor is not the disease, but is the amazing power of the body. So that's what made me
go through this journey.
Yeah, this journey for me is more cherishing what we can do, like because I was growing up liking athletes and liking to participate in sports, and really acknowledging what is the powerful tool that the body is. So this is what makes me go through my journey as a doctor to make other people also knowledgeable
about the beauty of our body.
So that's what we do. So we have congenital, developmental, infectious disease, and trauma. So it's...
Let's talk a little bit about the congenital neuromuscular diseases. Are they preventable?
Yeah, we know that countries that have better income have less of this, or a more structured health system has less of this, because they have preventive measures pre-pregnancy. Even
pre-pregnancy.
Yeah. So what the mother eats, folic acid, vitamins, and type of prenatal assessments can also spot few problems that a mother that will know that they are pregnant at 4 or 5 months of pregnancy, that you lost all the big part of the important development of the child in the beginning, to prevent some preventable, to acting to preventable causes of problems later.
So in a sense, like our diet and what we eat also affects that heavily. So even before the pregnancy period happens. Very interesting, actually. Now, let's say, for example, we weren't able to do anything about it in the prenatal period, in the pre-pregnancy. Let's say you got a kid and now you have to do something to fix. What's your approach? Like, are the congenital problems fixable?
Yeah, we have a big range of it, you know. I have big interests in neuromuscular conditions, and it's not a rock science. It's just, you know, you go day by day, you inform the parents. The first line of treatment is rehabilitation, because you have a brain that is high in plasticity. So more you strengthen these neuromuscular connections, more you early on, especially. But you know, we have neuroplasticity even today. If we decide to play an instrument, we change our brain, isn't it?
True.
So in a child, in a baby, big part of the management is to prevent, because you have the muscle imbalance that creates contracture, for example. So if you tackle the muscle spasticity, but you also try to aim to improve the strength of the muscles in the early age, you have a bottom-up training for your brain, because the brain also learns from what you are able to do. So a child that, for example, is not able to sit up or walk by themselves, putting them in a assistive device that makes them upright. It will train the brain to have a different level of vision connections. So we create an artificial upright position for the child that cannot stand up upright by themselves. And this is a bottom-up
approach.
Yes. And also the brain, as the inflammatory process goes down and the cells makes new connection, and different parts of the brain becomes in charge of the old cells that was supposed to do the job, but now they have this impairment from the primary disease, whatever it is. They reconnect and they restructure the activities, and the child can learn. So the first line of what we do is to have good physiotherapists, for example, and empower the mother to don't allow this child there. You know, put the child to participate, to sit, to listen to the conversations, to
participate in the action of the
there. So this is part of our work. So another big chunk of what we do is to balance the muscle. For example, we have orthotics. So a child that tends to have the muscle imbalance, the group of muscles that is more strong creates the pattern of the contractures. So you prevent, based on your knowledge, what is the most common patterns, because you know what the most strong muscles are. So before the deformities and contractures are there, you put braces, sleeping brace, orthotics, daytime orthotics. You don't want to weaken the child, but you don't want the strong muscles to prevail. And so you strengthen the weak muscles, and you prevent the strong muscles to create deformities. And when those things are not enough, then we have these small procedures. And for those surgical procedures, we have different techniques. So as everything in life, the concepts are few, but the ways to do it are many. So you just need to be consistent to the way you do. Yes, if you go to 5 doctors,
Mhm.
they will have 5
Different
different
solutions.
management planning.
Yeah.
But what works in my hands might not work in your hands
Yes.
because you are not consistent to what is the technique that I'm doing.
Mm-hmm.
So we first apply the basic concepts,
Mm-hmm.
and then we have a strategy to deal with. So we need to have the right dosing.
Mm-hmm.
We cannot do the surgery to make a muscle that is already weak more weak.
Weaker. Mm.
We try to face all the, cluster of problems that arrive together.
Mm-hmm.
So those kids with neuromuscular conditions, they have those weak muscles, the spastic muscles, and the spastic muscle is a weak muscle.
Mm.
And this creates liver arm problems, rotational problems, secondary deformities. So sometimes you focus on the primary the primary problem is the brain problem that you cannot fix. But the secondary problem is the muscle weakness and the strong muscles prevailing against the agonist muscle.
Yeah.
And so sometimes if you are early enough to fix those problems, you might have be able to prevent tertiary problems, that is liver arm problems, rotational problems, and all the other big things. So a child that is not having a proactive management end up in a situation that they will need more extensive procedures. So we have what we call multi-level single event surgery, single event multi-level surgery. That is a big shark attack that we fix different levels of the problems in a most smart way to have the one period of rehabilitation that is consistent and comprehensive enough to put the child back to the activities as early as possible. So, but we believe nowadays that a more proactive treatment prevents those shark attacks that we have to do for some kids. Neuromuscular diseases 20 years ago was do a little bit every year, so those poor children, they were through a syndrome that we called birthday syndrome. That's all year, every year of their life. They were in pre-operative, post-operative, or in rehabilitation. So this is counterproductive because you fix a small problems that creates another problem, and then you need to fix the again.
Like in a down slope from there.
So nowadays we have a more consistent, comprehensive way to allow the child to stand up straight and have the posture and engage the brain and do the rehabilitation once, and then go back as quick as possible, at least to the life style that they were pre-surgery. So this is more or less the plan.
That's very interesting. Like, I love how you spoke about preventing, or let's say working on the preventative measures are the key for, let's say, a better future. And I think, like, I've spoken to many professionals, and they always emphasize about the importance of trying to not go into, let's say, the hole, try to work before it, like preventing, taking care of the body, and early monitor of the situation is a way better option and approach for you to fix it later on when you have it at hand. Because when you have it at hand, then you might have to take more drastic measures, in a sense, to solve it. So I have a question that popped into my mind. You were speaking about the plasticity of the brain and how kids are good in learning things. I always wonder why kids are very good in learning new skills early on in their life, to the extent, for example, they say if a kid learns a language, it's easier for them when they are children rather than as we grow old. So why is that? Why is it better for kids to learn a new skill?
So newborn have much more neurons that we do. And however, they take the spoon and they have difficulties to
use it for the proper, let's say,
so
tool.
they need to prune all those neurons to have the ones that will do the activity in the proper way. So this is an intrinsic thing of the immature brain. So they have a ability to wire the system in different ways. So this is neuroplasticity, that is a type of primary neuroplasticity. We are all able to learn and have neuroplasticity, but we are not having the same type of neuroplasticity, because now we prune a lot of the cells based on what we do. That's why it's so important to have a wide range of things that you do, because then you have a brain that can go this way or that way.
I see.
So if you have a tennis player that starts at 4 and don't stop doing tennis only until they are 24, what this poor brain can do other than play tennis?
Nothing. Yes, literally nothing.
So you prune too much towards that activity. So, and usually the best tennis player are the ones that had the opportunity to engage in other things. They swim, this Italian senior tennis player, he was a skier.
Really?
Yeah. So, and he was very nice at that. And he said, well, I have to choose, or being a nice skier or being a tennis player. And he was very smart as a young man, because he said, oh, as a tennis player, even if I have a big mistake, I can go back and still win. But as a skier, if I have a big mistake or I break my neck or I'm out, there is no solution for that. So if you specialize too early, it's a bad thing. But the fact that kids are a sponge and they can learn in a different way is because they have all this differentiate central nervous system. And how we use the neuroplasticity. We also have the neuroplasticity, but we need focus. So whatever we need to learn, it's not that comes to us as a nice thing as it comes to the child that learns new language. But you need to put your attention and you need to create your new pathways and circuitry that will allow you to
navigate your way through that.
But needs attention. That's the only different thing.
Very beautiful, because then just now you have unraveled, let's say, maybe a misunderstanding that usually people have, that it's very tough for us to learn, for example, something new if we grow old, and it's easier if we have it as children. But now this is not the case, as from what I understood.
Yeah, and also, we have this emotional thing that, for example, I remember starting with weight training, for example, when I was 18. I remember it was really tough. It was not a piece of cake for me, because it was different. I was used to do karate before.
Yeah.
And it was a different thing. It was a little boring. And it was very painful. It was difficult. But people like to remember, oh, when I was 20, I was able to do my workout and I recover much better. And I say, oh, really? I'm not so sure.
I can tell you about my memories. Come, let me tell you. Sit next to me. Let me tell you.
And nowadays, I feel that, for example, if I'm out of the gym for a few days, it's easier for me to go back because I have, it's not this muscle memory that people call, but you are used to go through the difficulties and
Yes.
you can, have a sense of, oh, my body's a marvelous machine, but it's not a miracle. I need to work through this. So you adapt, isn't it? It's poor
So I'm thinking that
adaptation.
it's a matter of understanding the sensation and managing it in a sense. Beautiful.
A wonderful thing of being old is that you are more able to detach yourself from what feelings are.
How so?
Because you know your patterns,
Yeah.
and you have the experience to say, I've been through this, and I have the ability also to know your mistakes patterns, because your mistakes are not new. You have been doing it over and over.
I see.
So then you start to, the same way that you sit and meditate, as you age, you are able to, even into the situation, you are able to say, Harry, here we go again.
Yeah.
You're doing the same thing. I
Yes.
know you. Step
Uh-huh.
back and do it differently, please.
Yeah.
So this is the beauty of
Growing
older.
in life. Yeah. So why is it that young people are more attached to emotions in that sense? Like, why do we give them such a big weight as a beginning? Like, for example, you told me now, as we grow old, it's easier for us to detach ourselves from it. Is it something about experiencing something for the first time that make it very impactful on our emotions and our brains? What do you think?
I think it's also part of the neurodevelopment of the central nervous system. So this big area of emotion overtakes you as a big thing because you have an immature brain. So you cannot expect a 15-year-old going to a new school just to say, oh, they are all the same people as I am, and nothing will be different, and we want the same things. No, they are overwhelmed with emotions and questions, and it's part of the immaturity of the brain. It's part of being exposed to this for the first time. It's your how your family deals with this and prepares you, and it's multiple things.
Doctor, does the brain stop growing?
Yeah, the growing is a different thing. You don't create new neurons, but you can repurpose the circuitry. The neurons that are there. If you focus and you have consistent activities that you can
navigate your way through it.
You will change. So you can be a 90-year-old learning new things every day. Depends on how you approach and how you see also life.
I love that. Like, actually, I love this approach too, because it means that life is never ending. Like, we can always have a new thing, new experience in life. We can always learn a new thing. So because usually people have this fear of, if we grew old, we might like have a pause to life because we cannot experience new things. However, this is not true because we can still like experience new things. We can learn and have a different sensation to something which we might find beautiful. So we can have like an opening of a new chapter in life, even though as we grow old. So life doesn't stop at a certain age, and that's beautiful. That's beautiful.
Perhaps life never stops even after.
What's your perspective on the afterlife, doctor?
I think we come from a unity, you know, and life was there before me, and life will be here after me. So I think we long to expand because we have a soul or a bigger self, whatever you want to call, that is willing to know more, isn't it? So the fact that I believe we come from one that became
everything deviated from.
Yeah. This makes me very comfortable in myself because you are not better than me, I'm not better than you and anybody else. We have different experience and interests, isn't it? So, and this makes nature and humans beautiful, isn't it?
Yeah.
That we are all different and we are the same. And also this comes with experience, isn't it?
Yeah.
It's daily life things that you... And I think being a woman gives you the perspective of thinking more. You know,
Yeah.
I think we are brought up to have more of a administration of crisis.
Yeah. Yes.
That's what our mothers do, isn't it?
Well, you put it in a good way, yeah.
How many times we see our mothers, you know, overwhelmed, but, you know, making everybody comfortable and all the special difficulties that everybody has, a little bit more pleased and managed and accommodated.
Doctor, what's something that you can say to the young generation or a young person from your experience in life in general? Like, for example, give me an advice in life.
I think, you know, it's better to be interested in life than to be really knowledgeable, you know, because when you open to yourself the possibility that you still don't know, you are open to know more and to experience and to accept things.
Yes.
So more than gather too much of knowledge, be spaceful, you know, to create room to develop yourself, to have different interests, to, you know, create your own path based on your own truth, isn't it? Not what money will make or how successful you will be, but how truth to yourself you can be.
Yeah.
This is, I think, a basic thing in life, isn't it?
It is like being open to experiences, I think, is like part of what makes life colorful.
Yeah,
in a sense.
and if we are all unique beings, be yourself, you know, because if you just dilute what you are to be this or that, you lose the point. Then you are nothing, isn't it? You just
part of a group of what everyone else. You're not unique anymore. You're not your unique self, in a sense.
Yeah.
Like we have to be our unique self because each one of us have a different flavor of what makes them them. And this is, I think, like the beauty of humanity. These differences and how can we reflect that to others is what gives the color for each human. Beautiful. Doctor, on a final note, what do you think is the purpose of us here, like as a doctor? does you being doctor fulfills you in life? And what do you think are we doing here on Earth?
I think we are individualized self-expression of the whole. You know, I think nature is curious and open to put small particles of life in different dimensions to experience itself. Because if you are unity only, there is no way that you can experience what is this. So this is exactly what you were saying. Every one of us are a small particle of the unity that are here to experience this life. And we might be in a different dimension sometime soon. We don't know.
Yeah.
That will be a different approach to what the unity is and the possibilities of what we can be. I don't know.
Thank you so much, Doctor.
Oh, thank you.
Thank you so much for your time. I really do appreciate you, and it was a pleasure having this conversation with you. I learned so many from you, and I wish you nothing but the best and happiness in life for you and your family.
Thank you very much.
Thank you so much, Doctor.